What's going on? It is episode 29 of the Immerse and Nurse Show. You know what's funny though? Like if you look at all our episodes, whenever I introduce the episode, what number we are, you always go, woo! Woohoo! It's every single episode, guys. But let me tell you something, y'all. This one's the special one. You know why? You know why it's special?
I don't even know.
Because we're in a different place.
Oh, yeah. Notice we don't have the windows. It's different.
It's, and just bear with us, y'all. Okay, so this is my new house.
We're in the new house.
I might show a shot of it later in the clip, but we're in a new house. This is the first podcast, episode 29. Like I said, I know we missed last week. Like I said, it was just a hectic of, my mom was in New York City this past week.
New York.
And she was she was upset. She's like, you better not post no video without me.
Yeah, because I know he wanted to.
Yeah, but you know what? It's okay though. But we're here. I'm sorry for the delay. Like I said, the second episode, I feel bad that we've already missed another one in a row. But anyways, this is it, episode 29, y'all. And I named this one The Nurse's Family because I want to talk about that. So mainly because, working, I'm also with every job. Every job you have people who, they have to work on holidays.
Exactly.
Work on birthdays.
Yeah. Like nowadays, even you work in gas stations, they've always worked.
Yeah. No matter what.
Walmarts are open, Targets, all that.
Every place. But, I want to talk about, what is it like coming from, being the one that was being the son of somebody who was never there. You know
what's funny? I was telling you.
Ever. My life, but
I'm not getting it. I was just telling Ed about that. My husband, Noah's dad, and I said, "Oh, we're gonna be at Noah's. Maybe you can fill in and put your expertise." But then I was like, "Wait a minute, Noah knows firsthand because I've grown up. I've always been a nurse, so I said so. I was like, never mind. He got excited. Yeah,
he was happy.
Never mind.
But yeah, no, I mean, because like I said, every profession has one, but we're gonna look at it from like the nursing side, right?
Yeah, exactly.
So, in the nursing side, just like a lot of first responders, police officers, everybody, they're always there.
Yeah,
it's not like a 9 to 5, like a retail store or like
an office job,
clinic office job. Yeah, they work a 9 to 5 or a bank job. People always talk about, where they close on holidays or close on.
There was just because I watch TikTok a lot. There was this video and it's a lady with her headphones and she's doing a Zoom meeting and it says like 5 o'clock and she disconnects and so then her boss calls her and she's like, "What are you doing?" "Oh yeah, my hours are from 9 to 5 and it's 5:01. So we'll resume this tomorrow morning at 9.
And I'm talking about. She has a curly hair.
Yes.
She does the Starbucks one.
Yes, I could not stop laughing because I told Ed. I know he would always tell me, "Hey,
She has her cup. Okay, thank you.
Yes,
thank you. Bye."
But I was laughing the way she was telling her boss, and her boss was like, and she's put her stuff up in her purse. So my hours are 9 to 5. But I was telling Ed about that, and I said, many times you've told me like, "Hey, where are you? Text me where you at." It's not like I can just say, "Oh," and it never fails, right? When you have somewhere to go, a family thing, a holidays, you're just trying to get home. Something happens.
Yep, you get that late admission.
Someone falls. Not just
somebody starts coding. You're like, you couldn't wait 10 more minutes on. You couldn't die later.
And I
for
just
night shifts problem.
And I just go like, yeah. So I never plan on those. Those days.
Yeah, and and also like, I'm sorry, I just noticed that there's like on the bottom of the left of the corner of the table. You see that, like where the cock is? No, of the island.
Yeah.
The bottom left corner. You see that?
What's wrong with
that? Little black line. I think the caulking's messed up.
Okay.
I'm sorry. I'm just looking at the house over here, guys. I'm picky, icky, everything. But yeah, so anyways, back to what I'm saying. Like, when I was in the military, same kind of concept because a lot of the other jobs in the military, they had like your 8 to 5 work hours.
Yeah.
They, unless you're out in the field or doing an op, you're working 8 to 5. All right, you get off, go home, and that's it. You come back next morning. But starting early, I was in the fire service. You know what I mean? So we worked 24-hour shifts.
Yeah.
24 hours and then 72 hours every other weekend. And so every day is like, there's no like, hey, I'm going to take this day off. No, like you don't, no, you're working.
Yeah.
Where are you going to be this day? That's an on day. I'll be at work. Like there's no like, hey, can I take an off day? Okay, can I call in sick? There's no calling in sick.
Yeah.
So, I mean, especially military. I mean, other like, other, like fire departments nowadays or even nursing, you can call in, right?
Yeah.
But back in the military, there was no such thing as calling in sick.
Yeah.
You're going to go to work. If you wanted to have a day off or something, you better use your vacation that you get, because you only got 2.5 days a month.
That's it.
That's all you got.
And you want to stay
so
that
if you're
one,
sick,
yeah.
if you're sick or you want to take leave and like come home and see family, you have to save up your days.
Yeah, so you wouldn't want to use that.
It was pointless.
Yeah.
And so, but then like, especially over there, like with the girls and, you know, I was gone 24 hours. Michelle didn't work. She was always at home with the girls.
Yeah.
And she did as much as she could with them, but, you know, it wasn't a lot. And then, especially holidays, you don't have a choice. You have to be here, you have to be not. But so I think that, I believe for me, it really put me in that mindset of like, hey, your job comes first. And sadly, it's what it was. And so when I came here, I said, because I just got off orientation.
You're by yourself
I'm about to fly solo tomorrow. So yeah, guys, if y'all see this episode, hear this episode tomorrow, just know that I'm flying solo. Don't come to ER. But
the mama bird's pushing you out of the nest right now.
Yeah, they're like, good luck, you're done.
You're good. You're good.
I'm right there like, hey guys, I've never given this. How do you do it? Nope, no, you're done. Get away from me. I'm like, oh, okay. But no, yeah. So, but like, I kind of, because anyway, I got off orientation. I was talking to my director. She's like, hey, so like, what's your schedule? What do you want the schedule to look like? So we can, you know, they ask you, what would you like? So we can somewhat tailor it.
Yeah.
But remember, it's always main mission first. Like main, what do we need and what we're gonna put you, right? And I was straight up. I was like, hey, like I want to work. I want to get, because you know you do minimal 3 shifts a week, which is 72 hours. Yeah. I'm like 72 hours. I'm not even getting full 80. I said, oh hell no, give me an extra shift. Cause I want to do like a shift you did. Yeah. Like a 2 on, 2 off, and a 3 on. And doing that would give me 84 hours, which I'm happy with that. Yeah. I want to. I was like, I want to at least work 4 shifts and then 2 shifts the other week or vice versa. I want 7 shifts minimal. They're like, really? I'm like, yeah. I guess people only work 3 shifts minimal, right?
But I mean, right now you're new, you're fresh.
Might as well. Yeah, let me do it. Let me just rake in the.
You know what? You're not at that bitter age yet. I mean, the bitter.
What's the minimal I need? But I didn't know this that so if say I wanted to only do like 3 shifts a week, right? Which would put me at 72 hours. Yeah, I can put a request in to where they will pull from my PTO and round me up to 80. So I didn't know that. So to get a full 80-hour paycheck. Yeah. And I was like, I didn't know that was interesting. But they're like, yes, because some people, you know, which is nuts about the ER there is because everyone first off is like, say I wanted, you can work your schedule out to where you can be off like 5-6 days in a row. Yeah. It's super easy. And then because you're still making up your hours. Yeah. It's just, it's very flexible too. It's like, I know one of the nurses was like, hey, no, you have your schedule? I'm like, no. She goes, can you work for me this day? I'm like, sure, I can work for you that day. She goes, already, because she's setting up her schedule to have a couple extra days off. But that's how it's easy. It's nice to do that. So most people they had like PTO like over 200 hours.
I know.
And I was like, that's insane. Like, I remember dad was like, yeah, I got you some PTO. I'm like,
I got to burn 100 hours. And you're like, how the hell you get 100? Is it big?
It must be nice.
Hey, every time I get 4 hours, I'm leaving at noon. How do you build so many hours? I don't
know. But I know for us, we get about almost 7.5 hours pay period.
Really?
So it's almost 14 hours.
Okay.
Oh, about 14, about 15 hours a month.
But y'all also work 12, so I get it.
Yeah.
I get it. Yeah.
But I mean, shoot, like right now, I have a good amount. I'm like, that's 6 days of work I can take off.
Yeah, it's nice to work at a place where you get. I know. Yeah. I work at a place where I get sick time. Normally, when we were sick, you had to use your vacation time. So, because I was looking at my hours on the bank, and I was like, damn, I have. You mean I can be off a week? Well, I work 8 right now, but I'm going to be eventually be going
12
to 12. Yeah, they did hire They hired a new paramedic and a nurse. So
okay, that's cool.
So but they get training.
So hear this. So I was talking to one of the nurses, and he was telling me that out in one of San Antonio's hospitals, their ER, they have the main ER, and then they have something called a fast track. So think of it as like a little clinic to just minor stuff, right? Like flu, sick, scrapes, cuts, something minor,
something like
nothing
like
that,
it's after hours that you can go to.
Well, it's a part of the ER,
Oh,
so
okay.
24/7. But it's so it's instead of everyone flooding the main ER,
Oh, okay.
they have this fast track when they triage you. They're like, oh, you can go there. They come quick. If it's like a quick swab test or COVID test, bam, are you done? Stay home. Here's some antibiotics.
Yeah.
Versus, hey, you're gonna need a CT or some blood work, whatever. Then you go main ER,
Yeah.
right? Because there's more tests
Yeah.
involved. Well, anyway, so this fast track was talking to one of the guys, and because he's looking to go work, like a PRN over there. So apparently, their fast track is about 30 something beds, which is almost the entire size of our ER here. So
wow.
I put in your perspective how big this hospital is, right?
Yeah.
And their main ER is like almost 40 beds, 40, 50 beds. It's huge. But this fast track, so who runs it is there's like, he said, there's 2 paramedics and like 2 or 3 nurses, and they run the entire thing because they have their own protocols. First of all, the paramedics have their own protocols that they follow under their medical director.
Yeah.
So they can do a whole lot more. I mean, think about it, a paramedic and a nurse. They can do everything that needs to be done for a patient right then and there and get them out of there.
See, that's cool. That's the one thing about, like I said, one of the girls I work with, the one that I said she can stick anything, she's a paramedic, and it's amazing because she's doing her hours right now. We're talking about, and she was showing me all her hours she needs at like 124, but it's every topic. But then again, you think about it, paramedics have to know, cardio and I mean, everything. So so I can see that.
The paramedics are amazing. Like,
I can see that.
They know so much of emergency medicine to stabilize somebody that it's insane.
Yeah, and then I can see that, and they're seasoned with nurses.
But so what's cool about them is that they have their own protocols that they follow under their own medical director, right? So they can give these medications. They can give these, they're putting orders in based off what they're seeing.
Yeah.
So yes, people are saying, oh, well, they already have these in step. Like they have these protocols of what to give if they have this patient. Well, yes, but at the same time, it's up to that paramedic to, quickly diagnose what's going on with this patient and what to give them. You know what I mean?
Yeah.
Like I remember talking to, buddy Jacob, and the dude, the way that he can spit off cardiac medications is like insane because he sees a patient, he's really like, oh yeah, we're giving this, we're giving this, we're giving that. And I'm like, dang.
Yeah.
Which I know, I guess, a lot of it's, also experience. So once you do it a lot, especially in ER, because, I see we had a patient come in who was having a hypertensive crisis, was bleeding.
Yeah.
And so we had to bring his blood pressure down. Well, my nurse, she was like, oh, hey, we're going to get this medication, nicardipine, and then we're going to, titrate it to this much, start at this dose. And I'm like, what? I'm like, because normally we get the order, and then on the order it tells you what medication, what dose, how fast. You know what I mean? But experience of doing it so much, what it is. And I'm like, oh, and so she was and so we got the medication, pull up the chart, and it's right there.
Yeah,
and what she spat out was exactly what it was. And so, but just the experience of knowing this medication. But anyway, back to that fast track. I think it's crazy because these paramedics and these nurses, they're able to, pretty much triage, set up, treat, and kick people back out in the streets.
Yeah.
Once they figure out what's going on, and then of course the doctor overlooks it, and he's like, "Yep, okay, good to go," and that's it.
I think that's cool because it doesn't right now when you go to the ER, I'm just saying like the one here because we've all been there. I could go for one time I went because I was having a lot of heart palpitations, but there's someone out there who cut their finger real bad, just so cardiac. To then y'all get a car accident, so you can kind of knock people out quicker,
and then
people, wait time.
And then people, of course, people always get upset. Like it always is. They're like, well, how come I was here before them, or and they came in before they came in and saw them before me? You're like, well, sir, you're here because you show a triage of
they don't. Understand.
You have a headache, nausea, vomiting. Okay, versus we have this person over here who came in for chest pain. Sorry, y'all. That's my dog.
He's a beautiful dog. He's a German Shepherd. My husband just walked in right now. Anyways.
But anyways, yeah. But so but it's just ignorance. People don't know what's going on, and we can't tell them. Hey,
yes.
Okay, so let me rephrase this. So we had a person. I said the guy was bleeding. I had another guy who was going to go to ICU. Had another one who was a suicide attempt, and we were trying to find placement for her. And so I'm dealing with all these two guys are traumas. One guy, we got to fly him out of here to San Antonio. Yeah. The other guy, he's going to go to ICU. He's really sick. That she's upset because now we put her on emergency detention, and then now we're trying to find a facility for her to accept her.
Yeah.
So, and my fourth patient is just sitting there. Okay.
Yeah.
So all this is happening. Air Life gets here. I'm giving them report. I'm packaging up the guy, helping them to get them out to the helicopter to fly him out of here. Right.
Yeah.
So and then at the same time, they're calling me. Hey, they're ready for a report for that one guy in ICU.
Yeah.
I'm like, I'm giving a report right now. Like I can't.
Yeah.
And then they're like, hey, and so-and-so's on the line for nurse to nurse for that patient to go to the psychiatric hospital. Yeah. And so it's all of this is happening right now, right?
Yeah.
This was a couple weeks ago, and I'm like drowning. Like I really feel overwhelmed. And because I haven't been in a situation where I am needing like everything needs to be done right now. You know what I mean? There's I'm only me. If I had three of me, it'd be so much easier.
Yeah.
But no. I can't stop with my Air Life guy because we're packaging him. I call report. They're waiting for him in ICU. He needs to go now. They won't take her. This one's low on a priority list, but everybody's calling me and like, hey, no, what are we gonna do with this? No, we need you here. No, what you got to call over here. No, we got to call over here. I'm like, I'm trying to focus on this guy. You know what I mean? Because he's the most critical at this moment, right? And so I looked at my nurse and she was just looking at me and she's like, you okay? And I'm like, I'm trying. I'm trying. And she goes, can I help you? And I'm like, can you do me a favor? She goes, what? I said, can you call report on that one? And she was like, yes. So she took that one off of my workload. Yeah. So I got him packaged. We got a report, took him to the helipad, loaded him up. Bam, they're gone. And I come back inside. I call report for the ICU. Yeah. Vice versa. She called ICU. Got him out. I called nurse for the SI patient. And then as soon as that done, I called report to the guy who was going by Air Life to them. What to expect. And everything calmed down within like 2 hours. And I go see a patient, my other one, the fourth one. And it was a busy day in the ER, man. It was like in the early morning. You walk in there, you're like, oh, really?
Yeah.
But so I'm sitting there and I'm sitting there afterwards, and then I'll go see the patient, and she's like, "Well, don't you know that my son's in pain? Blah blah blah. He's in like he needs his medication now. Blah blah." And I look at the kid, and he's right here
on his phone
out there just playing. I'm like,
yeah.
And she was mad at me. She was like, "I'm like, man, I apologize for the wait time." I said, we were dealing with an emergency. Like it was really busy. Blah blah. And she goes, "Well, this is unacceptable." I said, "I understand. You're right. I'm sorry." And I just walked out. I mean,
what can you do?
Yeah, I'm sorry. Really? I mean, you're gonna be mad at me. That's fine. I'm sorry. Yeah. But like, it sucks that you can't, be like, I'm sorry. This guy was bleeding out his head. This guy was about septic. You know what I mean? I can't say stuff like that. But all we can say is like, hey, sorry, we were just dealing with an emergency. You know what I mean?
And you would think that there's people like me. If you would have said that, I would have said, but also I'm medical. But I would have said, okay, I get it. But no.
Remember I told you about that one time we had that code?
Oh, yeah.
And dude, I'm sweating, right? Because we're going to town on this lady. And after like 35 minutes of working her, they finally called it. And I'm just dying. Yeah. Because I told you, it was a weird, awkward position. We couldn't really do good chest compressions. We didn't use no back. It was weird. It was a really horrible situation. I'm drenched. My nurse with me, she's drenched. The tech, she's drenched. She got blood all over her. And so I go check on a patient, and I'm like, I didn't realize I was huffing. I was like, hey, I'm sorry, guys. I'm just beads of sweat. And I'm like, I'm sorry, I didn't, because it was like almost an hour I haven't seen him. I said, is there anything I can do for you right now while we wait, blah, blah. And they're just standing there like, no, everything's okay. I said, did something happen? I'm like, yeah, we had an emergency. And they're like, no, we're okay right now. Thank you. And I'm like, I looked at them, my head, I'm like, thank you. I appreciate you. I appreciate
Yeah,
you.
you're like, I bet they're going, holy, you probably look worse than what you thought you looked like.
Yeah. Well, and then, but so what's interesting is that, anyway, so the whole moral of that story was
Yeah.
like, I got overwhelmed. I really did. It was
Yeah.
just so much going on. And it was, and I was talking to my director afterwards, like the next couple of days. And she was like, so I want to ask you how you feeling, how you like,
Yeah.
how you doing, blah, blah, blah. Like how you liking it? And I'm
Yeah.
like, I loved it. Cause of course they heard about what happened of everything. Cause cause it was sucked. And they're like, so you got pretty overwhelmed.
Yeah.
You got a lot of criticals back to
Yeah.
back and dealing with all of that. I'm like, yeah. She's like, how do you feel? And I was like, well, to be honest, like it sucked, but
Yeah.
I've never experienced that before. And I was glad I was able to experience it with, the nurse, my preceptor still with me because she was guiding me. And, she let me drown. And she's supposed to.
Yeah.
Because there's a love the reference. Like one of my preceptors, he said, he goes, I'm gonna let you drown a little bit. You're gonna tread water. You're gonna feel it, but I'm gonna be right there.
Yeah.
To make sure you don't drown.
Yeah.
And I was like, I respect that. You make like, you kind of like you get thrown in the fire, but they're right there to grab you.
Yeah.
And
that's a good.
But it's a great precept because that's how I learn.
Yeah.
A lot of people, it should be how you learn because I know like a lot of people. Yes, you can read, you can study all you want, but unless you actually do it with your hands, you won't actually learn.
Yeah.
That's just me. I think most people are like that.
Yeah.
But unless you do it, so I was telling them, yeah, like it sucked, but I'm glad I experienced it. And and I drowned a little bit, and I was able to finish everything and calm down afterwards. And they're like, yeah, that's good because a lot of people, if something that happens, because majority of the time, it's probably not that bad.
Yeah.
You know what I mean? We're not in a high level 1 trauma center here.
Yeah.
It's a small level 4. You know what I mean?
Yeah.
We're not going to see these stab wounds, gunshots, this crazy, crazy stuff.
Yeah.
Doesn't mean we don't get stuff like that.
Yeah. You might. Yeah.
But majority of the time you don't. So whenever you do get something this critical, like a bleed, like a brain bleed, that's freaking critical. Or a dude's septic on top of what you're dealing with. That's a lot because a lot of people don't experience that. They don't have this X amount of emergencies happening back on each other. You know what I mean?
Yeah.
So, but experiencing it, I believe, it helped in the long run because I'm like, yeah, I've been through it. Now I know how to, I will talk to them. Yeah, what could I have done better? How could I have, adjusted this?
Yeah.
How could I have my priorities different? And everything went well. I mean, everybody lived. Everyone was alive and doing well. So I guess it worked fine.
Did you feel like a marathon runner as you're going up into the hall? So they're having you hand you little glasses of water, you're drinking it, throwing it.
Let's go and get there, put it on your head, keep going.
I need to go down the bar. I need some peanuts. I need something.
Well, they have like those little like gel packets, and like, it's just sugar.
Yeah,
you know what I mean. But I mean, they actually use it, so you're burning it. But no. Besides that, though, it was interesting. Like I said, and now I'm about to fly solo. It's going good, and pretty excited about that. Pretty excited.
And it's kind of gone by fast, huh? I mean, really think about it. I mean,
so one of my classmates, they are in a different hospital next to us, and they're in the ER as well. And I was talking to them, and I was like, hey, like, how's your residency program going? Because they actually had a residency program. And they're like, oh, they cut me at 10 weeks, and I'm on my own. I was like, damn. And they're like, yeah, it's going good. And I'm like, dang, because I got about 21, 22 weeks with somebody. So which I appreciate that because that always helped me walk into it. But I was like,
wow.
I said, damn, they just do 10 weeks. I was like, all right, good luck. They kicked you out there, huh?
That reminds me. I think I said it one time here where we have a little rec area, right, where the prisoners go, where the inmates go, and the bird fell, and the girls got they got the baby bird, and they took it, whatever. But I always laugh. I would say it was 2 birds, and I said, I bet they always look at each other and say, why couldn't mom have pushed us on the outside? Why did they push us on the inside? And as a matter of fact, one of the girls I work with, she took the bird. I mean, it wasn't like little when the eyes were shut, but it was. And I asked her the other day, I said, hey, whatever happened to the bird? And she goes, but she's so funny. Oh, he died. He died. But I just think about that. Like, when you're pushed off the nest, you would hope you hope you can already, at least,
exactly.
get some. But that is too funny. But like we were saying about that, like the holidays real quick and stuff. I mean, I know like, like Michelle and the girls are going to be learning real quick. Like, we have dinner at 6, but.
Well, not for me anymore. I won't be having dinner with it. I may have breakfast by dinner.
Yeah, but what I'm saying is they already know they're going to save you a plate.
Yeah,
I know. I don't know how.
Shoot, I got off last night, dude. Michelle made a pot roast. I got off. I was like, yeah, I sat here, dude. I was like 11:30 at night. I'm sitting here eating on the table.
That's the best food. I know many times. Poor Ed. He's always like, go to things. I'm like, bring me a plate. So many times I've gotten the plate out with foil, undid it, and warmed it up, and sit and look at your phone. Very lonely. And then I'm like, how's everybody doing? They're fine. I know. Okay. But yeah, it did. We have to get props to the husbands and the wives and the boyfriends and the girlfriends and the kids, just to know, this is our job profession. We may not be there. Well, of course, we'll always make it up if it's a birthday we're not there. Yeah. But you got to have them be understanding too, because we just can't cut off at 5, 6, 7 when our shift ends, because it doesn't work that way.
And I said, like, whenever you have something planned, there's always something happens right before you get out.
And like you said about you can't miss. I enjoy, like, my team. I enjoy them because they're hard workers like me. So we don't call in. We don't. I get it if you're really sick or something serious happens. But
for sure.
I know I can go to work and know the girls are going to be there.
Yeah,
I don't have it. Yeah, so that's always nice that your coworkers are going to. They're not lazy.
Yeah. So we all know that there's nursing shortages, right?
Yes.
Even though it's not nursing shortages it's not a shortage of actual licensed nurses. It's just a shortage of nurses wanting to work.
I saw a quick statistic. I was reading, earlier about stuff. They said by the year 2031, there is going to be so many nurse openings because a lot of nurses are going to be retiring. Are going to retire. And that's age, and that.
Oh, here we go. Well, you know how St. Luke Health System is tackling the nursing shortage?
How?
With the Moxie robot.
Is it the one? Is it one on wheels?
Yes,
with the face.
It's 4 feet tall. It has a LED face. Yeah. So they have been using. It says they have been using this robot, and it has been saving about 300 hours. It has been saving about 300 work hours.
Really?
They're saying that it looks like one of the charge nurses said. It's my first thoughts was that it looks like the robot from the Jetsons.
Oh yeah.
But. The whole point of it is saying that a lot of times the nurses get pulled from all directions, right?
Yeah.
Hey, you have this patient, you need this med, or you need this supply, that.
Yeah.
So they have to stop what they're doing to go to that room or go to pharmacy or go to go get something, right? Well, what this robot does is it's actually going to grab the med, going to grab a something from
something that from the supply closet too, or the pharmacy.
Yes.
Instead of having to stop and go to the closet,
go get some. Yeah.
Hey, that saves time.
Yeah. So just imagine this. So like you're in the hospital, and all of a sudden like Moxie, can you go give room 251 some yellow socks, please?
Are they all called Moxie, or you think they have different names? Well, that's kind of cool.
They probably call it different names, but it's the Moxie.
They need they need a Sprite and a turkey sandwich.
Now that would be amazing right there.
Because imagine how much time that you don't have to run and grab it.
Go and grab a blanket or go and grab a pillow. There's that stuff like that.
So does it not? Moxie here with your blanket. Can I see your bracelet?
So it says that the company estimates. So the company is from Austin, Texas.
Really?
Okay. And it says the company estimates its robots have already saved the health system more than 200,000 hours nationwide by from just grabbing stuff for the nurses.
Yeah, that is really cool.
So I don't know, man. Just, let's say you may be sick. You may go to the ER, go to the hospital, and next thing you know, you might be seeing Miss Jetson coming up, like bringing you some ice or something, guys. You just never know.
Well, okay? Also, what is it called? AI, artificial intelligence. How they're using that a lot. Me and Dad were talking about that over lunch today, and I was telling them that it's saving what it does, because I think about what is that movie with
iRobot.
with Will Smith.
iRobot.
So basically, what it does is, okay, let's say the doctor orders all these tests for me, right? And we're there, and so what it does is, instead of using like human manpower to kind of look through all the things and pass tests, it analyzes all the data. So it basically
It gives you like, hey, this is a possible diagnosis.
Yes.
Yeah.
And I said, I don't know how I feel about AI, but then I think
Skynet.
Yeah, I'm like, this reminds, Terminator. But anyways,
John Connor.
And they said that they expect, this is the new trend, so they're gonna.
I mean, like I said, y'all, if you go to the hospital,
I just don't want my robot like on iRobot, with just the face and not the rest of the head and stuff. It's weird.
And it says like it makes the eyes. Because like it will give high fives to nurses, and it makes the eyes like a heart. Can you imagine? It gets all mad because it's blue. The LED's blue.
It's all red.
It's all red.
Looking like The Exorcist.
Can you imagine, dude? Like being asleep and like how like you get meds every hour, like every 4 hours, right? It's like 2 a.m. You see the robot come up, like Johnson, wake up! It's time for your meds. or Johnson, wake up! We got a PT. Let's go. Let's walk.
Get up. Or what if it malfunctions? You're going to red rum. Remember that from, I don't even remember that, but it's murder backwards. And it used to be called on the Shining, it's Stephen King book.
Okay.
These kids would be like, red rum, remember? What if it goes up to you, red rum? But that's the new,
it'd be interesting to see what the next couple of years show from that.
Hey, I would like to see them in joke, because sometimes when they're cussing you out, I would program mine real quick. I type, you need to sit down and shut your mouth. I'd be like, yeah, Moxie, you tell him.
Throw water at
Right.
it. Shorting.
So sorry. I didn't. Or what if the robot would slap him? So sorry. Didn't mean to. You're like, you're controlling her. Right hook. That would be cool.
Oh, man. Well, guys, it's been a fun episode. It's been nice getting back into it.
I do have a quote.
You do have one for us?
Babe Ruth.
Go ahead. Give it to us.
Never let the fear of striking out keep you from playing the game. Wait, have you said that one before?
No.
Okay.
Never let the fear of striking out keep you playing the game.
I love that.
So guys, for the nursing health profession, I see that working as this. Never be afraid to give a wrong med and kill a patient. But keep playing the game.
Yeah.
Well,
you know what's funny? Speaking of, we talk about the nurses up north have unions, right?
Yeah.
So when we were in New York recently, and they had a parade. It was, of course, Labor Day was already passed, but it was that Friday. I'm talking every union, like the plumbers, electricians, the masonry. They all have unions up there.
Okay.
And they were all like they were different color. They were like some had black shirts and whatever. They, the union, the chapter.
Yeah.
And I was thinking, in a way, you kind of got to love unions. Yeah. Because what if when working construction, where the guy falls and, companies and, but anyways, I just thought, I didn't know they had a parade like that. I mean, they were just.
Was it packed? Was a lot of people there?
Well, there's still people are just walking so busy, but I mean, it was
everyone's walking by like, what's going on?
Yeah, just the tourists were stopping and looking. Everyone else was like, "We don't give, we don't give a damn. We got to go." But I thought that was kind of cool, and I was like, "That was kind of cool." It was for all the people that had unions up there.
Yeah, well, that's cool, guys. Well, I appreciate y'all. Thanks for joining with us.
Thank you.
Like I said, you can catch us on you can catch us on Facebook, see us on YouTube, pass us around Spotify, Apple Podcasts, all the good stuff. Okay?
What if every week we're like, "We're sorry, I bought a house now," or you're like, "We're sorry, I just."
Well, hopefully the plan is in the office where like I have it all set up.
Oh yeah,
I want to put 2 chairs there so it looks nice, not just a blank wall. And my wife has been not doing anything in this house.
It's okay. I bought her a little jack-o'-lantern, little light up jack-o'-lantern.
Yeah, it's right here.
Oh, okay. I thought where did you get this from?
No, I brought it. Yeah. Hey, I got to put some props.
Yeah.
Oh, man. All right, guys. We'll see you next time. Bye.